Question number 4, Rahui Katene.
Thank you, Mr Speaker. My question is to the Associate Minister of Health. Is he aware that a recent study of GP consultations in New Zealand revealed that opportunities for discussion about the misuse of alcohol and other drugs were not acted upon in 1/4 of the consultations, and what steps will the government take to address the service gaps in treatment services identified by the Law Commission?
The Honourable Peter Dunn.
Mr Speaker, I am aware of the study that the member refers to. It was a study of some 15 GPs. It was published in July 2009. Mr Speaker, the issues that it identified are under action by the government, particularly in the area of addressing service delivery gaps. Let me give the member some examples. We're investing approximately $22 million in the Tackling Methamphetamine Action Plan. We're providing more frontline training to staff in frontline areas and other government agencies on alcohol and drug screening programs and brief intervention. We've also got more work being done in the area of primary health care on that topic during the current year. And finally, Sir ALAC has been working particularly strongly in this area, and I understand that they have been supporting some pretty good examples of work in this field in PHOs such as in the Whanganui PHO, which is working very effectively.
Rahui Katene.
Supplementary to the Minister, what efforts have been made to consult with Māori providers of substance misuse and addiction services to ensure that issues are understood and care is delivered in a culturally appropriate manner by all healthcare professionals?
The Honourable Peter Dunn.
Mr Speaker, both the Ministry and I meet regularly with Māori alcohol and drug service providers to discuss that very point. It's also under action by a number of the DHBs in terms of the specific programs that they advance. And one of the pieces of good news that the member may be interested in, sir, is that the recent public education campaign being mounted by ALAC, where a number of advertisements regarding particular drinking behaviours are identified, has resulted in a 40% increase in self-referrals to the alcohol and drug addiction line.
Rahui Katene.
Thank you, Mr Speaker. Is he aware that the prevalence of severe alcohol-related problems in Māori is more than twice that in non-Māori, and that Māori are 4 times more likely than non-Māori to die of an alcohol-related condition? And what specific initiatives will be introduced to ensure that Māori are a priority population for identifying and managing substance misuse?
The Honourable Peter Dunn.
Mr Speaker, there are a number of measures that I could refer to. There are kaupapa Māori alcohol and other drug addiction services, such as that provided by the Te Waireka program in Hawke's Bay, Rangoatia in Hamilton, and Te Utahina Manaikitanga Trust in Rotorua. There's also a range of iwi-based NGO services in areas such as Northern, Midland, Central and Southern DHBs, and the National Alcohol and Drug Helpline has dedicated Māori staff available to work for it.
The Honourable Jim Anderson.
Speaker, does the Minister believe that by reducing the availability and promotion of alcohol, we would reduce the need for alcohol treatment services? And if so, will he support significant steps to reduce the availability and promotion of alcohol?
The Honourable Peter Dunn.
Mr Speaker, the Government will be announcing its response to the Law Commission's report on the sale of liquor shortly, and the member will have to wait until that happens. But can I just say on the linkage that he purports between the availability of alcohol and the need for treatment services, that point has been argued for many years. I think what needs to be borne in mind is that there do need to be adequate treatment services put in place. This Government, through the programs that I outlined in response to the primary question, is doing just that, and we will continue to improve the range of services available.
Ian Lees-Galloway.
Thank you, Mr Speaker. To the Minister, how do cuts to the St Mark's Adult Drug and Alcohol Treatment Centre in Blenheim, the Care NZ Clinic in Otahuhu, the Ashburn Clinic in Dunedin and the potential closure of the Hawke's Bay Addiction Centre address the gaps in treatment services identified by the Law Commission?
The Honourable Peter Dunn.
Mr Speaker, what we've got to look at is the range of services provided across the country, and services need to be in areas where there are needs that need to be fulfilled. This is an ongoing issue, Mr Speaker. I'm confident that the programs we have in place, the work that is underway, will ensure that the 7 recommendations that the Law Commission made in its report are given effect once those final decisions are announced.
The Honourable Jim Anderson.
Mr Speaker, what evidence does the Minister have as Associate Minister of Health that reducing the promotion and availability and accessibility to alcohol would not reduce the services required, the medical services required for treatment for those people affected by alcohol abuse.
The Honourable Peter
Mr.
Dutton.
Speaker, I don't have the evidence immediately to hand in the House today, but the point is that even though the level of alcohol consumption in New Zealand has been declining on a per capita basis for some time, there are still people who have significant alcohol and drug-related problems. We still have a responsibility to provide effective treatment services to deal with them, and we will do so.
Question number 5, Shane